Hi everyone, my name is James, and today I'll be presenting with Colleen, Alex, Emily, and Braden, and we will be going over the Coconino Health Assessment. So what is the health status? So the health status of Coconino has much to be desired, as 1 in 4 of our adults are obese. We have cancer and cardiovascular disease as a leading cause of death. But on a positive note, we have good leisure physical activity rates, we have positive social and economic factors, and we have short commuting times. But this positive spot may be skewed by Flagstaff and NAU students specifically. We do have subpar insurance and housing, and in the last 5 years, we have had an increase in accidental poisoning and alcohol-related deaths. And also, Native Americans are struggling as, on average, they die younger from these 4 categories.
The report outlined numerous social determinants of health. The biggest one that we picked up on was the large physical distance between population centers and adequate medical care. Coconino County is one of the largest counties within Arizona, with the majority of the population cornered in the southern portion of the community, which we see in Flagstaff that James pointed out. Overall, we see a poor provider to population ratio. Again, because it's a large county, it's very spread out. That ratio is skewed, but then also Flagstaff serves as the medical hub for all of northern Arizona. So you get a lot of residents outside the county coming in for care. This increases wait times and exacerbates even mild health conditions. The report also talks about food deserts, which they defined as anyone over 50 miles from a grocery store or other adequate food supply. The majority of these people in this county are receiving food from either gas stations or fast food establishments. So not the best food-wise. And then outside of Flagstaff as well, we see insufficient recreational facilities and sport leagues owing to a decrease in overall activity, which can play a role into the obesity that we're seeing. Among native populations, we see a higher alcohol health issue. Alcoholism, we see alcohol poisoning, liver disease, diabetes, depression, and higher rates of unintentional injuries. And this past year with the COVID-19 outbreak, we saw these native populations hit far harder than the other populations in the state. And then aside from that, we also see in Coconino County higher rates of larceny, aggravated assault, and rape. These things play a very heavy psychological impact on the overall well-being of the people. You are far less likely to prosper when you're constantly worrying about these things happening to you.
So do we believe that PTs have a role? Yes, we do, because we are movement experts, and we are playing a part in helping to treat the chronic conditions that these assessments address. And we also have a big role in education, educating people on chronic diseases, but also what PTs can do for them to help them continue onto a healthy lifestyle. But as all things in this assessment, access is a huge factor, which is why we created an initiative to help address that.
So as Colleen mentioned, our role as PTs hinges around that access to care within the community. So our initiative is basically focused on increasing that access to care. However, we've also tried to incorporate some of ways to mitigate the other goals that are outlined in the CHIP to also educate individuals in the community with hopes of minimizing the incidence of chronic illness, injury, and substance abuse. So our initiative utilizes 3 therapy task force teams, and each one is kind of geared towards a different goal. The first team is going to be a traveling group of therapists who is going to provide pro bono services to the rural areas who have decreased access to care. The second team is going to also aim to minimize this gap in access, but they're going to be providing telerehabilitation services. And then the third team will also travel and utilize technology to hold in-person and virtual educational events that are geared towards preventative measures outlined in the CHIP. So these 3 teams will work together to further provide resources within the community. And they're also going to work close with healthcare providers within those local areas to increase continuity of care.
So now you're wondering, who is this going to help? Well, obviously it's going to help all the residents of Coconino, but we're going to primarily focus on the residents in rural areas that have reduced access to care. So this will be in the area in between Page and Flagstaff, which are the 2 major hubs of Coconino. Also, we're going to focus primarily on the youth so that we can educate them and get them to a point where maybe they don't develop these diseases or don't develop or know how to treat once they do. We also want to hit those individuals with increased risks of chronic illness, injury, and substance abuse so that we can mitigate and help them treat what they already have and then mitigate them getting any more. We also are planning on coming in to help the community healthcare providers that are already in the area. We want to help decrease the burden of disease and then also help decrease their workload so that they're not working all hours, because as Braden mentioned, there are very few healthcare workers in these rural areas. So we're hoping to hold these events at local community centers, schools, and then other spaces that we acquire based on relationships we acquire there. So why is this necessary? Well, Coconino needs help. There's a lot of the social determinants that could be better. So we want to increase the access to care, improve the continuity of care, and by doing that, we'll have to start with educating the community. So that way they can then educate themselves and start educating their families. And this overall will reduce the burden of disease. PTs professionally have the right to do this. That's our job. But jurisdictionally, as long as we are providing care that we feel educated in, we're not going out and doing dry needling if we don't have a dry needling license, we're completely fine to do pro bono clinic. Personally, this is something that as long as your heart's in it, then you can go for it. There's no reason that PT shouldn't head out and help the community.
So how will this initiative be measured to make sure that it is successful? We're going to be using surveys to survey patients that we see at the pro bono clinic. This will just be to get a general assessment of their health when they come in and then to track it quantitatively over time. Additionally, with the surveys, we'll be doing intake forms. These are just standardized measures such as like the Berg Balance Scale or DASH index, just to get some numbers behind it. We also were looking at the EQ5D survey, which is used in conjunction with cost effectiveness analysis, and that goes hand in hand with quality assessments. So this is just to see like what we're doing and if it is effective from a financial aspect, and how it will pay off for the community in the long term. And then we also were discussing following a model clinic, researching other clinics who have maybe done this in their local areas and how successful it was for them.